Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinna Hankins.
And this is a pod full of pediatrics. And this is a one where we talk about varicella
vaccine and why vaccines are natural.
Okay. So varicella disease is officially known as the Varicella-zoster virus, VZV, and it's one of the herpes viruses that is throughout the world very common.
Right. It actually is, it causes two distinct types or forms of disease, which we kind of talk about separately, and actually has two separate vaccines.
Good.
So the first form of the disease is varicella, or what we typically call chickenpox.
And then the second one is zoster, which we call shingles.
And chickenpox is super contagious.
Highly contagious.
Like, I actually kind of think that this is crazy because the crazy thing about chickenpox is that the major form or the time of contagious is when you think you just have a cold. And the spread to household contacts at that time, when you have those cold symptoms with respiratory droplets and those types of things, is greater than 90% in the household with unvaccinated or immunocompromised people.
If you're not vaccinated, you're going to get it if someone has chickenpox in the house.
Yeah.
And it's spread mostly by the respiratory secretions, like from the cold, but then once you start getting the actual rash, it can be spread from the fluid inside the little
lesions. Yeah. Average incubation period is really long.
Yes, it's so contagious for so long.
Yeah, 14 to 16 days, but it can be up to 21 days.
Which is 3 weeks, just clarifying.
Yeah,
right?
You think you think you've made it? No.
No, you still can catch it.
That's right.
And the period when you can catch it is that couple days when you have the cold before the rash shows up until all the lesions have fully crusted, which they pop up every 4 to 6 days with new lesions. So that, again, that's like weeks.
Yeah, it's usually 2 to 3 weeks typically for a chickenpox full chickenpox course. So the presentation is really fever. You feel yucky, you don't want to eat, and then you get these itchy spots that kind of spread all over.
And that's one of the things we can tell chickenpox versus other viruses is that it literally goes everywhere. There's nowhere that is sacred for chickenpox. It's going to hit every part of your body, inside and out.
And in crops, all of a sudden you get this crop, and then 4 to 6 days later you'll get a new crop. And we have no idea where the name chickenpox
there's a lot
from.
of theories about where the name comes from. I kind of like the one that is like, it was like a chicken weaker form of smallpox, like it was like afraid. I don't know about that one, but it's definitely nothing to do with chickens.
That's right. It has nothing to do with chickens. The sad part, and really the reason we vaccinate, is because of the complications from chickenpox.
Yes. And most kids will be really itchy when they get chickenpox, and so scratching can lead to secondary bacterial infections, and some can be super serious and leave them to be in the hospital.
And the interesting thing about chickenpox really is that usually the scarring and those things are actually not as bad for little kids because they have really regenerative, amazing skin. But as you get older, like teens and especially adults, it actually the scars tend to be lifelong scars. And they also have this weird hyperpigmentation where it means it's dark spots that are left. Yeah. And those can also be lifelong.
But you can tell when someone has had chickenpox, when they were past probably 6-7 years old, because they'll get pock marks. And I worked in a free clinic where we'd have a lot of people come from different countries, and they wouldn't have any vaccine records, but I could always tell they had chickenpox because they had pock marks.
Yeah, or those little hyperpigmented macules all over them.
But they'll be there for life.
Yeah. And then you can have neurologic complications, which are the ones that really kind of scare everybody, and these next 3 are kind of all related to neurologic complications. Sometimes they can have these little focal deficits that kind of come and go, meaning they might be weak in some place, or
they get Bell's palsy where they can't move side of their face.
Right. And then they can have inflammation in their brain, like a meningitis, in their spine, a myelitis, or even in the vessels.
Yeah.
They can get this weird rash causing a vasculitis. And then it can lead to things like weakness all over the body, like hemiplegia, or where you can't use one side.
And the herpes viruses are known for parking themselves in nerves. And that's kind of what happens is sometimes the complication, it gets in a nerve, and then people can be left like they had a stroke.
Right. And then you can have encephalitis, which is a full swelling of the brain itself. And this is actually is 20% of the hospitalizations. And it can be diffuse all over, where it's like a coma. Or it can be where they just can't walk right.
And they just feel really dizzy and they can't get their balance. And people, you have like vertigo after you've been on a swing, like you just constantly feel like that.
But the mortality rate or the death rate from this is about 10% of those people who go on to have encephalitis from chickenpox.
Rye syndrome is a strange disease.
It is a strange disease.
That it kind of presents as nausea, vomiting, headache, delirium, combativeness, and often progresses to a coma. And it used to be a not uncommon thing for kids to get when they got chickenpox. And in the 1980s, they figured out, oh, it's because kids are being given aspirin for their fever that they got the Rye syndrome. And so now we don't give aspirin to kids at all.
We don't give aspirin to kids. And it wasn't just with chickenpox, it was likely with other viruses, but chickenpox was one of the major ones because the fevers would be so high and you'd have them for longer periods.
And chickenpox was so common,
and
right? It was
the
most common virus at the time when they were trying to figure out, like, oh, aspirin. I remember you taking those little St. Joe's chewable ones.
Yeah.
Remember that?
Yeah, so we don't do aspirin at all.
We don't do aspirin anymore.
And you just do Tylenol, ibuprofen, and both are safe and will not cause Rye syndrome.
Yes. And so pneumonia is another complication that can happen with chickenpox, but it's actually kind of uncommon in kids.
Yeah, more common in adults, and accounts for actually 30% of the mortality in adults with chickenpox.
Yeah. And then immunocompromised people, as we would expect, have more severe illness, and they are unlikely to get chickenpox because typically they're trying to avoid illness, but they account for a large percent of the deaths.
Yeah. And then newborns can get this congenital varicella, which is awful. Moms have to have been exposed or get chickenpox in a specific period of their pregnancy between 8 and 20 weeks. But it can lead to brain, vision, and limb abnormalities, and 50% of babies who have that exposure.
It's really, really sad when babies are born with it. So the hard thing, just like a lot of these things we talk about, we have vaccines for, there is not great treatment, right? For little kids less than 12, we don't really do anything other than treat their fever with Tylenol, ibuprofen, give them some oatmeal baths, right?
Calamine.
Like calamine, just try to get them not to itch it and get secondary infections.
Yeah, and that's really all you can do. And it is long. Like we really, like one of the reasons that, you know, chickenpox vaccine was such a, was such a game changer is that people would be out of work for 3 weeks.
And kids would be out of school.
Kids would be out of school for 3 weeks. And because like you have 21 days, like sometimes your first kid got it and then the next kid wouldn't get it until 2 weeks later.
All the time, right? And so if you had 2 or 3 kids, like you might have like 6 weeks of people having chickenpox in your house.
Yes, and that was all time off work, time off school, time off all of those things. And so it actually was a big economic burden. Plus, if for some reason the adults hadn't gotten it, it would be a big problem. So.
Yes. The treatment for over 12 is kind of a antiviral medicine, the ones we use for herpes virus, like acyclovir, valacyclovir, but they don't work great.
And you mean much higher doses, which actually have significantly more side effects. Like this can be dangerous to liver and those types of things, kidneys. And so if you are having to do those for high doses, long periods of time, not only are they not that helpful, but they can cause complications.
So varicella, like we said, super common before the vaccine. 95% of the people in the U.S. had varicella before they were 20, pre-vaccine.
Yeah, and it is a rare disease in the sense that it was actually really created for adults,
right?
But given to kids.
We decided, as public health, decided to vaccinate the children because the adults were the ones who were really getting sick with it.
Yeah, and what I tell parents really is that, you know, even if you decide to delay this, if your child hasn't gotten a wild type chickenpox by the time they enter school, and because we vaccinate now, they might not. You know, it is really important because the complications do get worse as they get older, specifically the complications like your skin lesions, but all of the complications are more likely.
And adults over 20 years old who get chickenpox, only 5% of the cases, but 55% of the deaths.
Yeah.
Like it really is deadly.
It is really deadly for adults. And so it's a very safe and easy vaccine, and that's why we recommend it. The other one is this other type, which is shingles.
Right. Or zoster, right?
Mm-hmm.
And that is a known complication of previous chickenpox disease. So you don't get it at the time. What happens, you get varicella, chickenpox, it parks itself in a nerve, and then later in your life...
It does park itself there.
It literally does, like a parallel park. And then it becomes reactivated later, and typically like in a time of stress. So you haven't got enough sleep, you had a cold, sometimes
You're pregnant.
You're pregnant, right? That's the scariest one. And it shows up in a dermatome, which is like, if you ever look up a dermatome map, it's so cool. Like they divide your body
cool.
into these lines, and this is like where the nerves
kind of move towards.
Yeah,
like,
I don't know if the nerves run that way. It's just the nerves give the information
to those areas.
To those areas.
Or take the information from
Yes, we explain that really like neurologists.
Yeah,
so clear.
So
But anyway, so it shows up as a dermatome as looking like the chickenpox lesions, but the difference is it's not over your body.
It's only in one little
It's just
spot.
one area, and most people will say that like before the pox come out, they just have really bad pain there, and then they start to get the lesions.
And the lesions themselves are painful too. This is actually really, shingles is super painful. Some people actually equate the pain to like worse than childbirth. I've never gotten shingles, but I really don't want anything worse than that.
Or like every toothache you've ever had combined into one place, which I have had a toothache, and I'm like, oh,
that would be awful.
Terrible.
And the rash lasts a long time. Again, 7 to 10 days, but the pain can last up to 30 or more. So this can be really devastating, the pain from shingles.
And there are people who get stuck with chronic zoster, and they end up having pain for months to years after the outbreak. And then even when it goes away, it can come back.
Yeah, about 5% of people who have a shingles outbreak will have another one.
And some people, if the dermatome happens to be the one by your eye, it can actually make you blind.
Yeah, it can cause damage to the eye itself. So what other complications can come from shingles? Facial palsy, like we talked about, meningitis, even types of stroke syndromes, and then this Guillain-Barré, which people are scared of with the vaccine, but actually it's way more likely to happen with the wild type of chickenpox.
Yes, and that is ascending paralysis, so that means that you start being paralyzed from your feet upwards, and so eventually you can't breathe without assistance. And for most people it's temporary, but not for everyone.
Not for everyone. And so in the United States, herpes zoster occurs in more than 1.2 million people annually, and it's estimated to affect about 30% of the population, and it primarily affects adults, and it can be affected in teenagers. It is contagious until the lesions are crusted over, so you have to avoid contact with unvaccinated or immunocompromised people, especially babies.
Especially babies, and I definitely had moms get it, in their chest, and they're breastfeeding, and the baby get chickenpox from that.
Yeah, and that, again, that's a time where it can be very dangerous. So,
which is why we developed a vaccine.
We did.
Like I'm taking credit. That's why the public health and some really smart scientists developed a vaccine. And it's interesting because the vaccine kind of came about because we got better at treating other things. So, leukemia used to be absolutely a death sentence for everybody, but especially children. In the 60s, they kind of figured out, oh, wait, we have some treatment we can do that kids are not dying from leukemia anymore. But when these kids were immunocompromised from receiving their treatment for leukemia, they'd be exposed to chickenpox because everybody had it, and they would die really quickly and painfully.
And so there were some really smart scientists who worked on treatments and prevention, and specifically a Japanese scientist, Dr. Michiagi Takahashi.
Such a natural pronunciation.
I know. Shocked the world.
Yeah.
In 1974, when he actually, again, made a vaccine. And this is a live attenuated. So I know we've talked about some of the differences in vaccine. But remember, this is like a part of the virus itself that they basically weakened. So you can kind of think of it being washed until like it's at its weakest form that will still like give you an antibody response so that your body can respond naturally as if it's seeing the infection, but without all of the infectious responses, meaning that you don't actually have to get sick from it. You can just make those antibodies to this very live attenuated vaccine.
And so in Japan, Dr. Takahashi and his group showed that the vaccine was safe, well tolerated, and protected children and adults from getting chickenpox after close exposure to other people with chickenpox. And they even tested some of these kids who had leukemia in remission and showed it was super safe for them too.
Right. And so it actually got introduced to the U.S. in 1995, so actually kind of quite a while after, but that's when we did it. And it was recommended in two doses. The first dose was at 12 to 15 months old, and the booster dose at 4 to 6 years.
And if you're older than 13, you get 2 doses, 1 to 2 months apart.
Yeah, and it was awesome.
Yes, it's a very, very effective vaccine.
It is, in 2 really big systematic reviews of over 40 studies of varicella vaccine effectiveness. A single dose of varicella vaccine had an approximate effectiveness of 80% in preventing varicella disease of any severity.
Yes. And then 95 to 98% to prevent moderate, which is 50 to 500 lesions, or severe, which is more than 500 lesions and complications. Like almost 99% for the severe disease.
Yeah, really impressive. And the vaccine decreases the rate of shingles. So this is the other thing. Like they're like, oh, you can still get shingles if you get the vaccine. And technically that's true, but you are actually much less likely to get shingles if you got the vaccine than if you were to have the wild type disease.
80%
So
less.
80% less likely.
Yes.
So, which is pretty impressive.
It is, and it's way better, right, than getting shingles.
Yeah, way better. So are there any side effects for
I mean, most vaccines are the same side effects in terms of it's going to hurt where you get it, right? Your arm or your leg, wherever the kid gets it. Soreness, swelling, redness within the first couple, 3 days.
What I think is really interesting too is that it's actually more after the first dose than the second. Like all of the, like even these small side effects decline after the second dose.
Right.
So
because your body's like, I know that.
I know that
it's
already.
Fine.
I got it.
Yeah.
So yeah, 1 in 5 children had like soreness, swelling, redness, and that usually is in the first few days after a dose.
Yeah.
And then 7 of 100 children had fever. Only 7 in 100
Right.
had fever after the first dose, and compared to only 4 out of 100 kids in the second dose. And then there were some, like 3 out of 100 kids who might have a few little, like
Just a little,
chickenpox
little
lesions.
spots there around, just right around usually where they get the vaccine.
And really, that's even more uncommon after the second dose too. And the other thing is that the serious side effects, like a seizure, a febrile seizure, or something like that, really rare. 0.8 in 1 million doses.
Wow, way less than the actual disease,
Right, especially when you're looking at like seizures and encephalitis, all of that have a much higher rate in actual wild type disease. So again, very safe and effective vaccine. I do want to say that like this is one of those things where we do look at the studies. So there is a combination of MMR and varicella called MMRV. And they used to give that at 12 months and at 4 to 6 years just to be able to combine them. And they found that actually the rate of fevers were higher and led to more febrile seizures if given at that 12-month. And so it's actually been for years now that
we don't give it at that toddler age.
At that toddler age. So
I mean, I would say for me, at least 15 years probably.
Yeah, like really long time.
Yeah.
I haven't been doing it. So we still give MMR and varicella on the same day. You just don't give them in the combined dose. And interestingly, it doesn't increase your rate of fevers as much.
Right.
But it's absolutely safe. Again, I think because of this, like even your risk of fevers at that second dose for both of those are much lower.
Your body's I got it.
You can give it together at that time.
4 to 6 years old.
Yeah.
So let's talk about the myth.
Okay, well, I did what I was just saying. Like, so this is really safe and effective vaccine, and really important. Like, not just on for keeping your kid healthy, but also really for like time and work and school and all the other stuff, right? It is
and not getting those scars for life.
And not getting scars for life.
You get enough scars from life from other stuff.
That's true.
We don't need to choose them any other way, right?
We don't need real skin scars. We got lots of other things.
Scars. Let's avoid them when we can.
So yeah, when we talk about the different myths with vaccines, one of the big ones is that vaccines aren't natural, and it's better to catch disease naturally.
And that is with chickenpox a lot. People tell me, I don't want to get the vaccine. I just want my kid to catch chickenpox.
So, and one of the big things with that is that we can talk about is the fact that we've already said with like things like chickenpox that you have some long-term consequences of that. You're way more likely to get shingles and have this, even if you do get it as a child. And there are complications even as a child. Like the complications are more rare than they are as teenagers and adults, but they still happen. And that is especially with babies and those types of things. Like your risk for those children is much higher, and immunocompromised or that type of thing. And so it is a way to keep your child safe.
And kind of when we talked before, for viruses, it's not like you have to have a pre-existing condition to make it worse. It's just the luck of the draw. Life is not fair. We talked about that in other podcast. Sometimes you just get a worse disease, even though you have no pre-existing condition.
Yeah, you're totally healthy.
And you don't know if your kid is that kid.
Not having any problem, and yeah, life is just not fair, and you get a really bad disease that has some significant side effects. And so, vaccines are amazing because really, they took nature, like this particularly, we just talked about varicella. It is the live vaccine, right? We just made it weak enough so that it only stimulates our body to have a natural, very natural response, make all those really great antibodies so that we are protected in the future, just as if we had the full disease.
Yeah, we're not faking the immune system,
we
right?
are not.
We're just waking it up and being like, hello, can you pay attention to this, please, and remember it for later? And
That's
it's like, okay, I got it.
I got this. So that's exactly what we do. We use a part of the natural virus, bacteria, and give our body a little tiny bit of taste of it, so it makes a very natural response.
Yes.
Just as if it would, but without all of the side effects. And so that's really what we do with vaccines, and why I think they're really the most natural way to protect your child.
Yes.
And the other thing to remember is that we're not in the same natural environment we used to be, right? We're a lot of times in big population zones where viruses, bacteria, and things can spread like they didn't like hundreds of years ago, right?
Yes.
I always like think of this: smallpox was not natural to the Americas.
No, and so it came when the Europeans brought it, they killed a lot of natives here,
Right.
Because that was not a natural part of their environment.
That's right. And that's a lot of these diseases are not natural to us, right? But our body can make very natural responses to them. And that is exactly what we're trying to do with the vaccine. So
we're trying to give our kids a leg up.
A leg up.
A leg up, like to get over the wall of disease.
That's right. And the decision to vaccinate is really not a choice between getting a medical intervention or staying natural, because truthfully, if you do get these diseases and you have complications from them, the wild type disease, you have to have medical intervention.
Right.
And the medical intervention is often really ones that do have actual real side effects or problems with it. And so if this is actually a choice of between getting a more severe disease that has to be treated aggressively, or getting a very mild vaccine form that our bodies can respond to naturally.
Yeah, and it's kind of we talked about along the way here, right? We're trying to eliminate our job. We don't want to see your kids sick. We really hate seeing your kids sick. We want to see them, healthy and happy, and not have to treat these complications.
That's right. This is a choice that getting vaccinated keeps your child and gives them a chance to stay healthy and happy. Additionally, vaccines do have really a lot of other natural benefits, which I kind of want to talk about, because I think it's really important. Like if you're talking about these natural lifestyles, right? This actually vaccines are a really good way to prevent superbugs.
Right.
Because again, if you're having these and having secondary infections, we're having to treat you with like stronger and stronger medicines as more people were having this problem, right? Since we did a lot of vaccines, we've talked about this for like different podcasts. I use a lot less antibiotics.
I really hate that they're called superbugs. It makes them seem like admirable.
I know,
right?
It does. They are not heroes.
They could be like the villain bugs.
They're super villains.
Super villain bugs. I think that would be so much better. We should totally rename that.
That's right. But this is when we vaccinate, we don't have the formation of those super villain bugs.
That's what we're calling it from now on.
And
for sure.
we actually can use less antibiotics, which really makes a big difference.
And then kind of we talked about, right, we're training the body. Like I always feel like vaccines are like, they're like in the training mode at the gym, right? Yeah. Like my immune system's like getting it together so that I'll be ready for the big fight.
That's right, exactly. And we reduce total pharmaceutical usage. Like, a lot of people now, through a lot of other information too, are being encouraged to use supplements or medicines that often have more side effects than the vaccines and are really expensive.
Right.
And while this benefits the pharmaceutical industry and the supplement industry, it doesn't benefit your child.
No.
And instead, we have a healthy alternative to help them fight disease naturally.
Yes, and most of us are worried about environmental pollution. We're worried about trash and landfills, and that's why we recycle and reuse as much as we can. But if you have a kid with a serious complication from an illness, you're going to go through a lot of medical intervention products products and create more waste for
Yeah,
our
especially with
environment.
communicable disease, like
Right, because you got to glove up, gown up,
chickenpox
mask up.
and measles in the hospital. Like they are totally isolated. You're like
terrible.
in
They
and
feel
out with
terrible.
gowns and masks.
These poor kids
and-
are so terrified. Everyone keeps coming in.
Yeah,
with masks
so it's really hard, and we produce a lot of waste, and so this is a way that it's really healthy. And then the other thing that we kind of hear that argument a lot is that, well, if we get it naturally, we're not going to get sick from it again, and that's actually also not true. So yes, like sometimes our vaccines, it doesn't keep us from totally getting sick. It just keeps us from getting, or totally getting the virus or bacteria. It just keeps us like not getting bad forms or complications from them. But that actually is the same for wild type. Like things like RSV, COVID, you get it once, you can get it again.
Yes, hand, foot, mouth. Oh my gosh, kids get it every year.
There's so many
right?
forms of that.
And
I
they
wish
never
we had
get
a vaccine
immune to.
for that.
I feel like one day we might get a vaccine for that.
But we don't right now.
We don't right now.
And it is miserable, right? And you
Right.
can keep getting it, even though the other cases might not be quite as bad as the first case. You can keep getting those things, and that's the part that happens with RSV and COVID. And then there's other ones like measles that literally just wipe out your immune memory.
It gets stuck in you sometimes, and it doesn't let anything else get stuck in you.
Yeah, and so this is actually it. So the immunity that we get from those vaccines is actually stronger, longer, better than the wild type form.
Yes.
And so again, vaccines are truly the more natural way to stay healthy, happy, and safe.
Which is what you want for your
That's
kids.
right. Very much what we want.
I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins, and this is A Pod Full of Pediatrics.